Hi po, everybody. Good afternoon. Welcome to my YouTube channel. Yung mga hindi pa nakakapag-subscribe, sana po mag-subscribe kayo, Doc G. Gervasio. And ngayon po ay episode 7, pinapamagatang mga SAMU'T SARING kaalaman ukol sa bangungot. At kung paano ang mga ito ay naging simulain ng the Philippine Bangungut Program. Ngayon, nung pinapresent po namin ito sa DOST, sabi ng isang teacher ko, hirap na hirap daw yung mga foreigner i-pronounce yung salitang bangungot. Pero sa ating mga Filipino, alam na alam natin itong bangungot. Wala atang Pinoy na hindi may alam kung ano yon. And galing ito sa dalawang root word na salita. Bangun, ibig sabihin to rise, tsaka ungol, to moan. And yun mismo ang nangyayari pag ang nawi-witness ng mga tao pag binabangungot, no? Ang medical term po para sa bangungot ay sudden unexplained death syndrome o SUDS in short. Noong 1917, itong napakagandang babae na doktora po siya, si Paz Mendoza Guason, ang unang naglathala sa medical literature ng bangungot or SUDS. And cited po siya sa napakaraming mga scientific work. Siya po ang naging inspirasyon ng aming Philippine Bangungut Program dahil si Paz Mendoza Guazon ay pioneer hindi lang sa medisina kundi sa marami pang ibang mga bagay. Ngayon, itong Philippine Bangungut Program po ay divided into two projects, yung Philippine Bangungut Project at yung Philippine Brugada Project. Later on po, i-describe ko kung ano yung Brugada. Ngayon, after po na-publish ni Paz Mendoza Guason, nasundan po ito ng pag-aaral ng US Center for Disease Control ng isang report ng mga Southeast Asian refugees, mga Laotian, Taga-Laos, at mga Hmong refugees sa Amerika. Napansin nila ang dami sa mga parang overseas workers galing sa Southeast Asian countries na ito na natatagpo ang patay sa tulog. Kaya after nila i-publish ito, naging sikat na po ang bangungot or ang SUDS sa buong mundo. Dito naman po sa Pilipinas, sa loob ng maraming dekada, yung acute hemorrhagic pancreatitis naman po ang naging sikat na eksplanasyon para sa bangungot. Pero mamaya ipapaliwanag ko kung bakit hindi tama ito base sa isang pag-aaral na ginawa ng aming grupo. Ito po, map po ito ng whole world. Makikita dito ang tinatawag na prevalence, meaning gaano kadami ang bangungot sa Pilipinas. Sa 2003 National Nutritional Health Survey Study na sinalinan po ng grupo namin, ay base dito naitalang 43 sa bawat 100,000 tao ang pwedeng nagkakaroon ng bangungot sa isang taon. Marami po ito kumpara sa Western countries. Sa study po ni Bear na pinublish noong 2007, nakita less than 1 per 100,000. Nangangahulugan na sa Pilipinas, mahigit na 40 times more common compared to Western countries. Pero sa Amerika, nakita na among Southeast Asian refugees na nakatira sa Amerika, mataas rin po ang prevalence o ang dami ng nagkakaroon ng sudden unexplained death syndrome. Kung kaya, tinawag itong Asian SUDS or Asian Sudden Unexplained Death Syndrome. So, sa susunod na 20 minutes, ito pong pag-uusapan. Didiscuss pa po tayo ng konti about the history ng bangungot, ang relasyon ng bangungot at ng hemorrhagic pancreatitis, at ang modernong view ng bangungot worldwide at sa Pilipinas. Nakakatawa pag titingnan natin ang kasaysayan ng mga kwento tungkol sa bangungot, napakalawak ng theory ng mga tao sa nagdudulot nito. Unang-una, maraming nag-aakalang dahil ito sa evil spirits. At dahil mga batang lalaki ang kadalasang binabangungot, sabi nila babae daw yung evil spirit na galit dun sa lalaki. Siyempre, hindi naman po totoo ito. Ikalawa, dahil common ito sa Asians, may nag-theorize naman, baka dahil sa patis o fish sauce. Dahil alam naman natin na ang fish sauce ay galing sa Asia. Hindi rin po totoo ito. Ikatlo, sabi nila, ang dami sa binabangungot ay mga manginginom, malakas uminom. Kung kaya, sabi nila, baka dahil ito sa deficiency ng vitamin B1 o thiamine deficiency. Na-disprove na rin po ito, pati yung berry na theory. And pang-apat, dahil ang mga bangungot victims ay malakas humilik, naririnig malakas humilik bago sila mamatay, sabi nila baka naman sleep apnea. Yung sleep apnea po ay isang disorder kung saan ang pagpasok ng hangin sa airway o doon sa daanan ng hangin ay nababarahan ng dila, ng taba, ng soft tissues around the airway. Pero napakita rin na hindi rin po ito totoo. Bago tayo mag-proceed sa hemorrhagic pancreatitis, magtanong muna tayo sa ordinaryong tao. Ito, tatanungin ko yung mga taong nakikita ko halos araw-araw.
Ang alam ko sa bangungot, kailangan bago matulog, yung tuna na yung kinakain mo, at saka kailangan din mag-pray ka bago ka matutulog. Magpasalamat ka sa Diyos na wala kang sakit, tapos bago matutulog, kailangan lahat gawin mo bago ka matutulog. Kasi mahirap matutulog ng hindi ka magigising pag oras na binabangungot ka eh.
Ay, Enteng, ano pagkakaintindi mo sa sakit na bangungot?
Ang pagkaintindi ko po sa sakit na bangungot ay yung bigla akong matutulog na nabusog tsaka napagod. Tsaka dapat din po na dapat magdadasal din bago po matulog para maiwasan po ang pagkasakit na bangungot.
Hi, Taco! Hi, Enteng!
At saka iwasan din ng sobrang pagod at sobrang pagkain sa gabi at sa hapon. At huwag din kagad matutulog. Ayun lang.
Okay, dumako naman tayo doon sa theory ng hemorrhagic pancreatitis. Mangyari po, marami sa mga tinatanong kong mga edukadong mga Pilipino, ito pa rin ang inaakalang sanhi ng bangungot. Pero saan nga ba nanggaling yung pag-aakalang ito? Balik tayo sa 1948 sa Hawaii Medical Journal. Inilathala ni Majoska na sa isang pag-aaral sa Filipino migrants na nakatira sa Hawaii noong 1940s, nakakita sila na 21 out of 28 na inaakalang namatay sa bangungot ay may hemorrhagic pancreatitis. However, ang finding na ito ay base lamang sa tinatawag na gross pathologic finding, meaning hindi pa yung detalyadong mga autopsiya. Ngayon, noong 1998, itong si Dr. Munger at yung kanyang partner na si Buton ay nag-publish sa International Journal of Epidemiology ng isang pag-aaral na ang pamagat ay Bangungot in Manila. Ang pag-aaral na ito ay binase nila sa review of death certificates na kinalap nila galing sa Manila WPD, Western Police District. Dun sa death certificate, nakalagay syempre yung cause of death. Kung hindi nyo po nalalaman, kasi sa Pilipinas, nasa batas po na pag ang isang pagkakamatay ay nangyari at hindi maipaliwanag, mandated by law na gawa ng autopsiya ang biktima ng pagkamatay. And syempre kasama doon ang bangungot dahil hindi nga nalalaman kung bakit binabangungot ang isang tao, especially noong panahon na yon. So, base sa review of death certificates niya, nakita niya na acute hemorrhagic pancreatitis ang naka-sign out o ang nakalistang cause of death dun sa mga apparently binabangungot. At yung bilang ng porsyento o yung porsyento ng may ganitong sign out diagnosis increased very much from 22% in 1948 to 70% in 1982. Ang pattern na na-observe sa mga binabangungot, it occurs commonly between 1 and 4 in the morning, and the peak time of the year is between December and January. However, ang grupo namin, kasama ng iba rin mga grupo, ay nagtanong, hemorrhagic pancreatitis nga ba? So ang ginawa namin ay nakapag-publish po kami ng isang study sa Heart Asia noong 2014. Kasama ko po dito si Dr. Maria Cecilia Lim, si Dr. Joseph Palmero, among others. At itong dalawang doctors na ito ay kasama ko rin sa the Philippine Bangungut Program. Sa pag-aaral na ito ay nag-enroll kami ng mga bangungot victims between 18 and 50 years of age na ang criteria ay namatay sila sa tulog at healthy sila dati, wala silang nalalamang ibang sakit. And yung autopsiya ng mga bangungot victims na ito ay ginawa sa Philippine National Police Crime Laboratory at saka sa University of the Philippines College of Medicine, Department of Pathology. Ngayon, para maging mas scientific ang dating ng study na to, kinumpara namin yung mga bangungot victims versus age and gender matched controls. Ibig sabihin, naghanap kami ng equivalent niya na autopsy rin sa isang healthy individual para may basis of comparison, no? Ito ang characteristics ng dalawang grupong pinaghambing namin. So yung SANDS, yun yung bangungot group, nakahanap kami ng 24 na bangungot cases compared to 24 healthy age and gender matched controlled. So most of these were trauma and accident victims. So the average age of the cohorts was 32 for the bangungot group and 34 for the controls. 91% were males, so talagang majority lalaki. 4.7% of the bangungot group had warning blackouts, yun yung syncope na tinatawag. At walang merong abdominal pain. So parang, di ba, pag pancreatitis, masakit na masakit yon. Pero base sa history ng bangungot group, wala sa kanilang nagkaroon ng abdominal pain. At wala rin sa kanilang may history suggestive of heart disease. As many as 16.7% of bangungot cases in this study had a family history in a first-degree relative. What are the key findings of the study? Nakita na 70% ng bangungot autopsies showed normal results. Ibig sabihin, walang makitang abnormality sa organs ng mga bangungot victims to explain the sudden death. Moreover, when we compare the bangungot group with the controls, the healthy controls, there was no significant difference between the bangungot group compared to controls. And looking closely at the heart, there was not any significant difference in the number that had atherosclerosis, valvular heart disease, hypertrophy, RV dysplasia, and so forth down the line. Pumunta naman tayo sa hemorrhagic pancreatitis kasi para sa akin, ito yung isa sa pinaka-significant na contribution ng aming study sa kaalaman dito sa Pilipinas. So, ganun pa rin, no? Kino-compare natin yung bangungot group versus the control group. May two types of autopsy. Meron tinatawag na gross autopsy, meaning yung pathologist inspects very well all the organs. And there's the so-called histopathologic autopsy, where samples are taken from the different organs at inaaral ito under the microscope. Nung gross autopsy ang pinagbabasihan, 9 cases of bangungot were signed out as hemorrhagic pancreatitis. However, closer study with histopathology revealed that there was no pancreatitis. In other words, there were no hemorrhages, there were no signs of necrosis, and there were no signs of inflammation, ruling out decisively that hemorrhagic pancreatitis is the cause of bangungot. Sa madaling salita, hindi na po pancreatitis ang tamang sagot sa sanhi ng bangungot. Ngayon, kung hindi naman pancreatitis ito, ano nga ba? Ano nga ba ang kondisyon na maaaring magdulot ng biglaang pagkamatay sa isang taong healthy, bata, walang ibang sakit? At base sa isang pag-aaral ni Dr. Otto noong 1980s, nag-theorize siya na ganun kabiglaan, normal autopsy, siguro sa puso galing, siguro sa kuryente ng puso. And true enough, in the 1990s, the Brugada brothers, tatlo sila, si Pedro, si Ramon, at si Joseph Brugada, found this peculiar electrocardiogram sign, ECG sign. Nakikita to sa ECG ng iba sa mga biktima at kapamilya ng mga pwedeng bangungutin. Ang tawag dito, the Brugada ECG pattern. And for medical students, it is characterized by a J point and a cove type of ST elevation in leads V1 to V2. Moreover, the Brugada ECG pattern may be accompanied by a heralding blackout, meaning bago sila bangungutin, maaaring nagkakaroon na ng warning blackout spells ang pasyente. Napaka-significant po nito kasi kung ma-identify kung sino ang mga potentially pwedeng bangungutin, maaaring gumawa ng certain treatments para mapigilan ang pagkamatay ng mga bangungot victims na ito. Ano ba itong treatment na to? Siguro maaring yung iba sa inyo, alam niyo kung ano yung pacemaker. Nagkaroon na rin po ako ng previous episode on pacemakers. Merong gadget na parang pacemaker, may baterya rin. Ang tawag sa kanya ay ICD, Implantable Cardioverter Defibrillator, na inilalagay sa ilalim ng balat. Ang ICD na to ay nagmo-monitor ng heartbeat 24/7 at mapipick up niya pag nagkaroon ng any abnormality that causes bangungot. Ang gagawin ng ICD, magde-deliver siya ng shock para maibalik ang abnormal rhythm back to sinus rhythm or normal rhythm. And this is life-saving. Nabubuhay po ang pasyente, nakaka-recover back to normal after the shock. And the patient can even work with the ICD. He can be employed. Pwede pong magtrabaho ang pasyenteng may ICD basta po maagapan bago po magka-brain damage or cardiac arrest. For medical students, the cause of the ST elevation on the ECG is shown in this graphic. In panel A, you have the epicardial in solid line and endocardial action potentials overlapping, producing the normal ECG pattern. In panel C is the start of the Brugada Syndrome, where there is a divergence between the action potential in the epicardium in solid line versus the endocardium in dotted lines. Note that this gradient in the membrane potential is what causes the current that leads to the extrasystole or the premature beat that triggers the ventricular fibrillation, leading to sudden cardiac death. So far, what is known about bangungot? First, alam natin it affects young, healthy males and commonly presents, if not detected early enough, with sudden unexplained death during sleep. As many as 1/3 can be familial. Pwede pong tumatakbo ito sa pamilya. There is an ECG marker, which I have earlier shown, called the Brugada type 1 ECG pattern, which to date is the most useful marker. However, there are limitations because we have theorized, and that is part also of the objectives of the Bangungut program. We have theorized that not all bangungot is Brugada. There is an overlap, but they are probably distinct conditions. The ECG pattern is waxing and waning, which means that you will not pick it up at every opportunity that you perform an ECG. What are the things that may accentuate the Brugada ECG pattern? Fever is one thing, and that is perhaps the role that alcohol plays in triggering the attack, because an inebriated or a drunk person will have a higher basal body temperature. That is perhaps also why this condition is particularly found more commonly in people that live in cramped, warm, humid quarters that are not air conditioned. In the Philippines, bangungot occurs in 43 per 100,000 Filipinos, but its Brugada ECG pattern is found even more commonly in 0.2%, even if majority of this 0.2% are asymptomatic. However, small studies that we have conducted to track those asymptomatic Brugada ECG pattern individuals have shown that the event rate among asymptomatics may not be negligible after all. This is again the world map showing the prevalence of the Brugada ECG pattern. Now you can locate the Philippines. Just gazing at the graphs, you will see that we have a much higher incidence compared to Western countries. On the basis of all the SAMU'T SARING information that I have just presented, has been born the Philippine Bangungut Program. And this has recently been given the go signal for public funding come 2023. As mentioned earlier, it will be divided into the Philippine Bangungut Project and the Philippine Brugada Project. This is the framework of the program. One will appreciate that there are two cohorts. There's the Bangungut cohort and the Brugada cohort. These two cohorts will be the source of the list of genes for Filipinos, which will then serve as the basis for crafting our Filipino-specific molecular autopsy kit and a Filipino-specific genetic screening kit for sudden unexplained death. Aside from the publications, we are targeting setting up an inheritable arrhythmia clinic at the Philippine General Hospital, which will offer medical and refer patients for ICD implantation as necessary. A family genetic counseling service will also be offered in this clinic. And then we hope to set into motion the first steps towards developing the genetic test kit. Finally, we also target formation of a multi-agency network for sudden unexplained death syndrome. In the future, we hope to expand to also inheritable cardiomyopathies, do future studies on cost effectiveness, set up linkages with PhilHealth so they can hopefully help with the ICD implantations, start a policy to mandate molecular autopsies, because at the moment, only regular autopsies are required for sudden unexplained deaths. And finally, we hope to include data in the National Rare Disease Registry as mandated by RA 10747. The general objective of the program is to systematize the diagnosis and management of sudden unexplained deaths in the Philippines by paving the way for a customized panel of genes to be used in molecular autopsies and genetic analysis, setting up of an inheritable arrhythmia clinic, and creating a multi-agency network that will allow prompt diagnosis and treatment of afflicted individuals and their families. The methodology is shown on screen, and both cohorts, both the Bangungut and the Brugada cohort, will undergo a pedigree, family genetic tree construction, complete genetic analysis, including whole exome sequencing and targeted sequencing. WES will use next generation sequencing, and finally variant calling and classification to divide those that are pathologic from those that are of unknown significance and those that are not pathologic. The collaboration plans are shown on screen. The UPPGH will serve as the command center and the venue for the arrhythmia clinic and the genetic counseling center. Linkages have already been formed with the Philippine National Police and NBI forensic laboratories. In fact, 2 of the members of the program are the forensic pathologists in these 2 laboratories. And my partner, Dr. Lim, is the forensic pathologist at the UPPGH. A linkage will also be set up with the Philippine Genome Center, where the genetic analysis will be carried out. So ito po ang summary slide for the Philippine Bangungut Program. We're very excited because we just have recently gotten approval for public funding. And it has really been more than 100 years since Paz Mendoza Guazon, shown on the stamp, discovered or first described bangungot in the medical literature. She, being a pioneer, was really, as mentioned earlier, the inspiration for this program. And the goals have been extensively discussed earlier, but just to reiterate, genetic testing, molecular autopsies, referral to the inheritable arrhythmia clinic, genetic counseling, referral for ICD implantation, and more importantly, the multi-agency network to streamline and speed up diagnosis of bangungot. And so the tagline for our program is, at the end of this all, we want to change the narrative of bangungot in Filipinos. Matagal na pong naging misteryo ang bangungot. It's about time na baguhin natin ang kwento ng bangungot sa mga Pilipino. So sa mga hindi pa nagsasubscribe, hit the subscribe button below. See you next time for the next episode of Heart Talk with Doc G. Bye-bye. Stay safe.